Imagine taking $1,000 every month for the next 3 months and then every 3 months thereafter for the rest of your days and placing it on red or black at the roulette table at the casino. Well, that is the equivalent to what your chances are with the overpriced, overhyped, oversold, and massively overutilized hair restoration treatment that is PRP, platelet-rich plasma. In today's video, I'm going to give you 3 big reasons I do not personally recommend PRP to my patients or perform it on my patients. I will also give you some very interesting ways in which you can achieve pretty much the exact same results as PRP in the home for less than $20. And as always, if you would like to get your hands on our medical board's free hair loss ebook, simply watch to the end and follow the prompts and I will get that out to you ASAP. If we haven't already connected, I'm Dr. Jonathan Hopkirk, a Sydney-based hair loss doctor and someone that has been through it all myself. I've gone through a hair loss journey over the last decade and I have had side effects, positive effects, trials and tribulations, and that's exactly why I do these videos, so I can give you the best chance of avoiding the same mistakes and give you an even better chance of success. I've also previously worked as the head of medicine for one of the biggest global cosmetic clinic chains there are in the world, so I have a very good understanding about the ins and outs of the commercial world within cosmetic medicine in the hair restoration space. Alright, before we jump into today, I want to give you a little quiz. So, you're sitting there doing your research on PRP because you're interested in fighting hair loss. Well, out of these 3, which would you think would represent how many randomized controlled trials there are that have been published on PRP and angiogenic alopecia? Is it 10? Is it 110? Or is it 20? Select one of those, place it in your mind, and I will reveal the answer in just a few moments. Before we crack into the 3 key reasons, let's just give a brief rundown around what PRP is. So PRP stands for platelet-rich plasma. This has been widely used in medicine in a number of different disciplines, but it is utilized in hair restoration medicine for the benefits that are housed within a platelet, which are growth factors. So essentially what happens in a nutshell is you are placed on a treatment bed, you have a sample of your blood taken. This is then spun in a centrifuge device, and so it factions off the different components of blood or the different constituents of blood, and then the clinician will then siphon off the platelets and then they are injected into the scalp where they are said to take effect. So why are platelets beneficial? Well, no one has really given a strong consensus on exactly what the mechanisms are, but it's theorized that the growth factors can have an influence on signaling pathways. They can influence the dermal papilla cells, they improve blood flow to the follicles, and it is said that they improve the anagen to telogen ratio. So there's lots of theoretical science around why platelet-rich plasma is said to be effective for hair loss, but actually how effective is it? And that is what I'm going to dig into today and give you the 3 reasons around why I do not believe in it personally. So this is my personal opinion. If you have your opinion, feel free to fire your opinions in the comment section, but I like to practice evidence-based medicine for hair restoration. Now let's dig into the 3 key reasons. Key reason number 1 is just simply the lack of evidence. So if you had that mental note around what that quiz number was for you earlier, well, you will be interested to learn that when you go digging into the ChatGPT or whatever AI platform you like, or Google, whatever search engine you like, and you go looking for literature on platelet-rich plasma and alopecia, so just broadly hair loss, you will find about 43 randomized controlled trials, which is said to be the most reputable way and most credible way to assess and appraise a treatment or an ingredient. So there is 43 randomized controlled trials as of July 2025 on the use of PRP in alopecia, so in hair loss. Then when you dig a little bit further and you refine that to PRP and angiogenic alopecia, so male or female pattern hair loss, there is actually only 10 randomized controlled trials where you are critically appraising and assessing the effectiveness and safety of PRP versus placebo. What is interesting then is if you go a little bit further and you start to say compare PRP to other things on the market that are less invasive, cost you far less, are researched far more, well, what would you find? So if you compare, say, PRP to minoxidil, well, interestingly enough, when you look at some of the head-to-head studies, of which there's not many, but if you look at this particular head-to-head study, where you have women that were using either PRP or 5% minoxidil foam, interestingly enough, the minoxidil foam on a bunch of different metrics outperformed PRP. Where PRP was superior, and this is what I find is interesting, is it was superior on self-reported results. So patient satisfaction with PRP versus minoxidil. And there's probably a couple of things to that. One, putting a foam on your scalp every day isn't necessarily something that people want to do. And having injections into your scalp tends to lead to a bit of a suggestion effect. So we as humans feel that if something is more invasive, it has to be better. More invasive means more better, for the worst English you could ever possibly practice. So when people have something which is as invasive as PRP, they think this has to work because it's so brutal, it's so painful, there's so much process to it. There's the spinning of the blood, there's the sampling of my blood, there's the re-injecting. It's almost medieval. So people convince themselves that it has to be better. So it's not surprising that self-reported outcomes were better for PRP. However, if you just looked at the crude metrics in terms of improvements in density and thickness, minoxidil outperformed PRP in this head-to-head study. What about then if we looked at something, say, incredibly cheap, doesn't cost you a whole lot to perform, can be done in the home, and you can do so with less invasion, less pain? Microneedling. So microneedling is widely used within medicine, and especially in hair loss medicine, for its benefits of improving hair thickness, reducing inflammation, improving blood flow to the scalp, seeding a bit of a growth factor response locally as well as the stem cell response. Sounds a lot like the science of PRP. Interestingly, when you compare microneedling to PRP, such as they did in this study with a split head trial, so they're taking 30 men with androgenic alopecia and they've treated one side of the scalp with microneedling plus PRP, and then the other side of the scalp with microneedling alone. What did they find? Well, there was no statistically significant difference between the two sides. But interesting, microneedling outperformed PRP plus microneedling with respect to hair thickness increases. So isn't that fascinating? What does that say to us? What it says to us is the benefits that you're potentially getting from PRP is from the actual trauma caused to the scalp itself. Now, arguably, it's possibly too much trauma, and that may well be why microneedling with much more controlled trauma actually outperforms PRP on some of those metrics. But this has long been a point of contention where hair loss doctors and researchers will say, actually, is it the platelets that are being injected into the scalp with PRP, or is it the micro trauma or trauma being caused to the scalp, which is leading to this healing reaction, which we know can prompt positive things within the body? So that is a very interesting paper. And then that leads me to tell you, if you want to get as good a results as PRP in the home, obviously you would seek counsel from a medical professional first, but you could get a microneedling device and you could achieve these results and not have to pay the thousands and sit in the chair and have your blood sampled and all the rest of it and go through PRP. So there's a little hack for you. So that's number one. What about number two? Why do I not recommend PRP to my patients or perform it on patients? It causes significant amounts of trauma. So just as I was detailing in that first segment, micro trauma is an important thing when it's controlled, but when there's too much trauma because you're freehand injecting into the scalp willy-nilly, well, that's not necessarily giving you the best return. And it actually has been theorized, and there's fairly strong consensus now amongst a lot of hair loss doctors that you could actually be causing too much trauma. Now, when you look at the most recent microneedling studies, it's actually been shown that a shorter or a more superficial penetration into the skin, i.e. 0.5 of a millimeter, outperforms 1 millimeter and outperforms 1.5 millimeters. So when you use a microneedling device, you have controlled trauma in a very systematic, methodical way. And you can perform this over the entire scalp. Now, often PRP is injected freehand with needles into the scalp, and it's usually they're using a 27 gauge needle, which is quite large. So you're causing huge amounts of trauma to the thing that you're trying to help. The other interesting thing about causing too much trauma is when you cause too much trauma, you cause significant blood flow to that part of the scalp. If you cause significant blood flow, you change the hydrostatic forces they're happening locally in the scalp. So what that means is if you've got so much blood flow into that area, you're likely actually pushing a lot of those platelets that you've injected into that area to have effect locally. You're pushing them either out into the systemic bloodstream again, where you've drawn them, so that's counterintuitive, or you're even potentially pushing them up onto the scalp. So when you're causing lots of trauma, you are potentially pushing a lot of those platelets away from the area that you're wanting them to take effect, which is around the base of the follicle, which is around where the bulge is. When you're pushing them away, they're not going to be having the effect that you want them to. So causing too much trauma, which causes too much irrigation, is not a positive thing. The other thing is, if it's brutally painful, no one is going to comply long term. And that is one of the biggest reasons you see in cosmetic clinics and hair restoration clinics across the globe. And I know a number of these where you've got a nurse or a physician that goes, I've got a centrifuge, but it just sits on my bench in the back room. Reason being is it becomes too painful for people. They just don't keep up with the cadence that is required for them to have that 50-50 chance of benefit. So that is number 2. And number 3, it doesn't address the underlying cause of androgenic alopecia. So we know that hair loss is multifactorial, but we also know that a big part of androgenic alopecia, the underpinning thing that is leading to miniaturization of the follicle, is this interaction. It is this predisposed sensitivity that your follicles have with hormones floating locally in the circulatory system in your scalp. So DHT. PRP does nothing for DHT. It does not counter the effects of DHT. When people see best results from PRP is often when they're combining it with other ingredients. Often minoxidil is set to have a better effect, and it's been shown in studies to have a synergistic effect with PRP more so than PRP or minoxidil alone. Why? Well, as we see with microneedling, you can increase the potential of minoxidil because you increase the amount of the enzyme that is circulating locally by activation from the trauma that is created in the scalp. You increase the amount of that enzyme that converts minoxidil from its prodrug form into its active drug form. So yes, when you have PRP with other ingredients, you're going to get a synergistic effect, which might then prop PRP to look better than it actually is. Likelihood is you probably achieve just as good results if you used a microneedling device and saved yourself the thousands. But PRP does not address the underlying cause. It does not address the DHT component. It does not address the hormonal component locally. So even though you might get a bit of a growth spurt for a few months, if you don't support or if you don't address the underlying cause, you're not going to stabilize the loss and you're not going to have best results ongoing. So there we are. So in summary, there's the 3 reasons. 1, a lack of convincing evidence. Number 2, it causes too much local trauma in the scalp and it's incredibly painful. And number 3, it doesn't address the underlying cause of androgenic alopecia. It has no impact on the hormonal interplay, which is actually leading to hair loss in conditions like androgenic alopecia. So I hope you've learned something out of today. If you have questions or comments, please fire them away in the comments section. If you would like to get your hands on our medical boards ebook with over 75 years experience packed into it, you can simply email me at jonathan@levelsofyou.com and I will get that sent over to you. But please make sure that you like and subscribe beforehand. Tune in next week for another video on hair loss treatments and hair loss conditions. I hope you've enjoyed today and I look forward to seeing you again next week. Cheers.